means
Hello.
every other creature is what it is simply because of what it does. But a human being
Hello. Hello.
Yes, sir.
Hello.
Yes, sir.
Okay, am I audible now?
Yes, sir. Yes, sir.
Okay. Hello and good evening. मेरो स्क्रिन देख्न सकिराख्नु भएको छ? सबैजनाले देखिराख्नु भएको छ?
देखिरहेको छु, सर.
Yes, sir. Yes, sir.
Okay. Okay, today the topic is infective endocarditis. It is relatively shorter than other topics. So, definition ले आफै भन्छ infective endocarditis है. इन्फेक्सन भयो कुनै इन्फेक्सनले गर्दाखेरि इन्डोकार्डियममा इन्भल्भ भएको छ भने दैट्स इन्फेक्टिभ इन्डोकार्डाइटिस फर श्योर. Okay. Infective means any infection, maybe bacterial, viral or fungal, anything, any infection. Maybe it may be due to rickettsial infection as well. So some microbial infection, microbes ले गरेर कुनै infection भएको हुनाले infective भन्यो. Endocarditis भनेको why it's called endocarditis because it involves the endocardium, which includes heart valves. Valve may be native or prosthetic valve or lining of the cardiac chamber, which is also endocardium, and any congenital anomaly like ventricular septal defect or atrial septal defect. And the causative organism is usually a bacterium, but maybe a rickettsia, chlamydia, or fungus, as I already mentioned. So what's the pathophysiology? Infection कसरी हुन्छ? तपाईहरुको के क्वेशन छ भने ह्यान्ड रेज गर्नु होला. Okay. In some sites of pre-existing endocardial damage भयो कुनै पनि कारणले भने त्यो ठाउँमा इन्फेक्सन हुन एकदम मन पराउँछ है. Typically occurs at the site of pre-existing endocardial damage and on the sites where there is high blood flow, massive pressure भएको ठाउँमा endocardium को त्यो बेलामा हुन सक्छ. And infection with virulent or aggressive organism जस्तै staph aureus ले normal heart लाई पनि attack गर्न सक्छ. IV drug misuse ले गर्दाखेरि staphylococcal endocarditis of the tricuspid valve, which is very much common. Okay. Okay. अहिले मेरो कुरा सुनिरहेको छ? Am I audible now?
Yes, sir.
Yes, sir.
Okay. So it typically occurs on the site of endocardial damage and infection with very notorious organisms, virulent and aggressive organisms is very common. And in case of IV drug misuse in people who are involved in intravenous drug misuse, staphylococcal endocarditis of the tricuspid valve is common. And endocardial damage can be caused by high pressure of jet of blood, like in ventricular septal defect. Ventricular septal defect ma ke huncha? And you would know that. कसैलाई के आइडिया छ? दुईटा भेन्ट्रिकल राइट र लेफ्ट भेन्ट्रिकल को बीचमा सेप्टम को बीचमा एउटा डिफेक्ट हुन्छ जुनले गर्दाखेरि right or left ventricle, they communicate with each other. तर communicate कसरी गर्छ? Usually right ventricle भन्दा left ventricle को pressure धेरै हुन्छ, so directly तपाईको त्यही oxygenated blood मात्र हुने भयो, अनि oxygenated and deoxygenated blood they get mixed up, right? So ventricular septal defect ma endocarditis is very common. Any patient who come with a history of congenital heart disease, so they should be, if they come with fever and everything, every other symptoms, you will come across that. त्यस्तो symptoms लिएर आयो भने infective endocarditis हो कि भनेर हामीले शंका गर्न मिल्छ. त्यस्तै गरेर mitral regurgitation, aortic regurgitation मा पनि mitral and aortic valve, they are involved in high pressure jet of blood. So in that case also endocardial damage हुन सक्छ. or low pressure lesions, कहिलेकाहीँ low pressure lesions मा पनि हुन सक्छ, such as large ASD भनेको atrial septal defect, but minimal. So in this case endocardial damage is minimal. Endothelial damage भयो, high pressure jet of blood भयो भने deposits of platelets and fibrins, they are vulnerable to colonization by blood-borne organisms, है. एउटा कुनै पनि ठाउँमा endothelial damage हो भने कुनै पनि तपाईको normal injury को process तपाईहरुले pathology मा पढेर आउनु भएको deposits of यो platelet and fibrin, platelet clump भएर बस्छ नि हैन, त्यो ठाउँमा blood borne organisms हरु आएर colony form गर्न सक्छ. And even a vascular valve tissue and presence of fibrin and platelet, त्यसले झन् aggregate गर्छ, which protect proliferating organisms from host defense mechanisms. So these यो जुन बन्यो प्लेटलेट क्लम्पमा गएर ब्याक्टेरिया अथवा कुनै पनि माइक्रोब्स गएर कोलोनाइज भएर बस्यो, कोलोनी फर्मेसन गर्यो, त्यसलाई भेजिटेशन्स भनेर भन्छ. सो भेजिटेशन्स इज कम्पोज्ड अफ अर्गानिजम, फिब्रिन एन्ड प्लेटलेट which grow and may become large enough to cause obstruction or embolism. है, त्यही एन्डोथेलियमको आसपासमा आएर obstruction अथवा even it can cause embolism. Tissue destruction and abscess पनि हुन सक्छ. Valve regurgitation may develop due to damaged valve, tissue distortion, cause perforation or disruption of chordae. यो valve regurgitation को I'm sure you know it already. कसरी regurgitation हुन्छ, what is the mechanism of regurgitation, कुनै पनि valve बाट blood किन backflow भइरहेको छ due to damaged valve, it's obvious. And how the damage occurs, it occurs because of tissue distortion. कुनै पनि कारणले गर्दा टिस्यु बिग्रियो, इस्किमिया भएर valve नजिकैको टिस्यु इस्किमिक भएपछि नेक्रोसिस भयो, त्यो टिस्यु काम नलाग्ने भयो. सो द valve ले राम्ररी क्लोज गर्न सकेन, सिस्टोलको बेलामा ब्लड पम्प गर्नुपर्ने एउटा नत्र पल्मोनरी तिर, भेन्ट्रिकलले ब्याक टु एट्रियम पठाइरहेको छ, रिगर्गिटेट भइरहेको छ है. अनि इट क्यान बी ड्यू टु कस्ट पर्फोरेसन और डिस्ट्रप्सन अफ कोर्डे टेन्डिने मसल्स यो एन्डोकार्डियममा हुन्छ नि, त्यसको डिस्ट्रप्सन भएर पनि हुन्छ. सो देयर आर सम एक्स्ट्रा कार्डियक म्यानिफेस्टेशन्स एज वेल, सच एज भास्कुलाइटिस एन्ड स्किन लिसन्स. हामी त्यो पनि अहिले एकछिनमा हेर्छौँ, which are due to emboli or immune complex deposition. So even यसमा पनि immune complex deposition हुन सक्छ, emboli पनि हुन सक्छ. So what's the most common cause? The most common organism is streptococci or staphylococci. Almost 3/4 of the cause. So gram positive cocci, हैन, or gram-positive organisms are the most common causes. त्यसमा पनि streptococci र staphylococci, they are the most common. And streptococci को पनि एउटा typical group छ, the viridans group of streptococci. जस्तै Streptococcus mitis, Streptococcus sanguis are the commensals in upper respiratory tract. Upper respiratory tract मा Streptococcus mitis र sanguis हाम्रो upper respiratory tract मा commensals हो. त्यस्तै गरी Enterococcus fecalis, Enterococcus faecium and Streptococcus bovis may also enter the blood from bowel or urinary tract. So there are multiple sources. You can see that upper respiratory tract बाट आयो भने that might be commensals like Streptococcus mitis and Streptococcus sanguis. Bowel or urinary tract बाट आयो भने Enterococcus है intestine बाट Enterococcus हुन्छ Enterococcus faecium Enterococcus fecalis Streptococcus bovis है bowel or urinary tract बाट त्यस्तै गरेर miliary and Streptococcus bovis. Okay, just a minute.
Sir, हजुर मिट भयो सर.
Okay, so Staph aureus, Staphylococcus aureus, it originates from skin infections, abscesses or vascular access sites like intravenous or central lines. ICU मा बसेको पेशेन्टमा एउटा सेन्ट्रल लाइन भन्ने हजुरले देख्न सक्नुहुन्छ जुन नेकको बेसबाट एउटा intravenous line हामीले कनेक्ट गर्छौं that is called central line. त्यो सेन्ट्रल लाइनबाट हुने कमन इन्फेक्सन भनेको Staph aureus, Staphylococcus aureus. It is a skin commensal. Otherwise, Staph aureus is present in the skin in abundant amount. So other causes of acute endocarditis may be Streptococcus pneumonia and Streptococcus pyogenes as well. So I'm sure you have come across these terms. Your organism को बारेमा microbiology मा तपाईहरुले पक्कै पढिसक्नु भएको छ. Sometimes there is post-operative endocarditis after cardiac surgery. This केले गर्दा हुन्छ Staph epidermidis. Staph epidermidis also occasionally in contamination. Surgery गर्दा contamination ले गर्दा हुन सक्छ. Staphylococcus lugendensis rapidly destructive acute endocarditis गराउँछ. Coxiella burnettile Q fever endocarditis गराउँछ, and it is usually common in people who are in contact with farm animals. Gram-negative bacteria of the so-called HASEC group भन्ने हुन्छ एउटा. सबै gram-negative organisms यसले पनि गराउन सक्छ. They are hemophilus, HACK, HASEC. So not only gram-positive is the most common. Streptococcus and Staph are the most common, but gram-negative bacteria of the HASEC group are also the common causes. HACK भनेको hemophilus, actinobacillus, Cardiobacterium, Eikenella species, and Kingella kingi. Brucella is also sometimes associated, where there is history of contact with goats or cattle, and yeasts and fungi. Even fungus can cause infective endocarditis in immunocompromised hosts. Fungal infection intravenous line मा पनि हुन सक्छ, and the most common fungi are Candida and Aspergillus. So this is a picture taken from your own book, Davidson's. यसमा देख्न सक्नुहुन्छ कति पर्सेन्टमा हुन सक्छ दुई किसिमकै भावमा इन्भल्भ गर्न सक्छ यो अर्गानिजमहरु त्यति नोटोरियस हुन्छ जस्तै Staph aureus कोगुलेज नेगेटिभ भाल्भमा युज हुन्छ यसले इन्फेक्ट गर्न सक्छ आईभी ड्रग अब्युजर्समा अनि प्रोस्थेटिक भाल्भमा त्यस्तै गरी स्ट्रेप्टोकोक्काई मा पनि नेटिभ सबैमा इन्भल्भ गर्न सक्छ एन्टेरोकोकस स्पिसिस intestinal infection बाट जान्छ HASEC group gram negative group polymicrobial where many microbes are involved in endocarditis other bacteria fungi and sometimes even with negative blood culture right? So clinical features the symptoms may be subacute or acute. In subacute endocarditis there is these symptoms can be seen like persistent fever, unusual tiredness, night sweats, weight loss, signs of valve dysfunction or heart failure. May present as an embolic stroke or peripheral arterial embolism, purpura and petechial hemorrhages in the skin and mucous membranes may be seen. So you can see the symptoms. Joro आउँछ, unusual tiredness हुन्छ, night sweats हुन्छ, weight loss हुन्छ, अनि there are other signs. Your symptoms by signs of valve dysfunction or heart failure हुन सक्छ. Heart failure को signs जस्तै edema, अनि त्यसपछि chestमा crepitations, त्यो सबै देख्न सकिन्छ. Sometimes may present with features of embolic stroke and or peripheral arterial embolism, and purpura and petechial hemorrhages in the skin and mucous membranes. Skinमा hemorrhagic spots haru, fever आइरहेको छ, hemorrhagic spots छ, purpura छ, अनि त्यसपछि mucous membrane मा पनि bleeding spots haru छ. त्यस्तै गरी splinter hemorrhages on the fingernails or toenails हुन सक्छ. Conjunctival congestion हुन सक्छ. Osler's nodes, which are painful tender swellings in the fingertips. Right? Note that fingertips मा हुन्छ, हात छाप्दाखेरि fingertips मा painful tender swellings हुन्छ. That are probably the product of vasculitis. And digital clubbing is a late sign. Clubbing पनि infective endocarditis मा common sign हो. Spleen is frequently palpable in Q fever or Coxiella infections, and microscopic hematuria may be seen. Okay. So acute endocarditis, अघि थियो subacute, अब acute endocarditis मा febrile illness is present with prominent and changing heart murmurs. So one of the other signs that can be seen is changing heart murmurs. Heart murmurs change भइरहेको छ है. Embolic events are common and cardiac or renal failure may develop rapidly. Abscesses may be detected on echocardiography, and partially treated acute endocarditis behaves like subacute endocarditis. Sometimes there is post-operative endocarditis where unexplained fever is present in a patient with heart valve surgery, and it usually involves the valve ring and may resemble subacute or acute endocarditis. Morbidity and mortality are high. Range of organisms is similar to that seen in native valve disease. Okay. Subconjunctival hemorrhage, मैले भनेको थिएँ 2 to 5% मा देखिन्छ, यस्तो देखिन्छ subconjunctival hemorrhage. You can see over here, conjunctiva को तल hemorrhage जस्तो देखिएको छ हो. And के देखिन्छ, cerebral emboli हुन सक्छ sometimes. This is a picture showing all the clinical features that we have learned till now. Roth spots in fundus, ophthalmoscopy गर्नु भने roth spots देख्न सकिन्छ fundus मा. रेटिनोस्कोपी गर्यो भने रथ स्पट्स अर्को पनि एउटा डिजिजमा देख्न सकिन्छ, मलेरियामा पनि समटाइम्स देखिन्छ रथ स्पट्स. एन्ड पेटेचियल ब्लिडिङ हेमोरेजेस अन म्युकस मेम्ब्रेन्स एन्ड इभन इन फन्डस. ओके, पेटेकियल हेमोरेज देख्न सकिन्छ. पोर डेन्टिसन, समटाइम्स त्यो दाँतको कारणले गर्दाखेरि नै इन्फेक्सन क्यारी गर्छ, त्यही भएर पोर डेन्टिसन. एन्ड स्प्लिनोमेगाली मे बी प्रेजेन्ट इन 32% इन लङ स्ट्यान्डिङ endocarditis. And systemic emboli like nail fold infarct भनेको थियो नि, यही हो nail fold infarct भनेको clubbing हुन सक्छ. And this is the splinter hemorrhage. You can see petechial rash and purpura. Some purpura are present over here. Finger मा nodes हुन्छ, Osler's nodes भन्छ, kidney बाट blood जान्छ, hematuria हुन्छ. And heart failure may be present in 40 to 50%. See, the most common feature over here is hematuria. So हामीले नसोचेको कुरा हेमाचुरिया 60 to 70% मा प्रेजेन्ट हुन्छ र कार्डियक फेलियर 40 to 50% मा प्रेजेन्ट हुन्छ. So how will you make the diagnosis in case of infective endocarditis? यो क्वेशन आएको थियो तपाईहरुको लास्ट एक्जाममा. So this is called modified Duke's criteria अथवा modified Duke criteria. It has got two sections, the major criteria and minor criteria. So the major criteria involves positive blood culture, okay? Positive blood culture in which typical organism is present from two cultures, and the persistent positive blood cultures taken more than 12 hours apart, 3 or more positive blood cultures taken over 1 hour. So the most important major criteria is blood culture. एउटा blood test त गर्नै पर्यो. त्यसपछि the next major criteria is endocardial involvement. Positive echocardiographic findings of vegetations and new valvular regurgitation. So echocardiography गर्दाखेरि के देखिने भयो, vegetations देखिने भयो, and new valvular regurgitation देखिने भयो. And there are some minor criteria. There are 7 minor criteria. They are predisposing valvular or cardiac abnormality. We know that endocarditis occur in previously injured endocardium, right? So predisposing valvular or cardiac abnormality भयो भने ASD, VSD भयो भने त्यसमा धेरै देखिन्छ. Intravenous drug misuse, fever 38 degrees centigrade or more, embolic phenomenon, vasculitic phenomenon, blood culture suggestive organisms grown but not achieving major criteria. Major criteria में blood culture को criteria typical organism, persistent positive blood culture र 3 or more positive blood culture and suggestive echocardiographic findings. Okay. यसमा तपाईको definite endocarditis र possible endocarditis छ. Definite endocarditis 2 major हुन पर्यो or 1 major and 3 minor or 5 minors criteria हो. Definite endocarditis possible भनेको 1 major and 1 minor or 3 minor. So we are going to need some tests to confirm हामीले criteria बाट नै थाहा पाइसक्यौ modified criteria बाट. So what are the tests? The first one is blood culture. So 3 to 6 sets of blood culture should be taken prior to treatment. 3 to 6 sets of blood cultures. Treatment antibiotic सुरु गर्नु भन्दा अगाडि 3 to 6 sets of blood cultures should be collected. Aerobic and anaerobic cultures दुईटै गर्नु पर्ने हुन्छ. Echocardiography मा के देखिन्छ? Vegetations, sometimes valve damage, sometimes abscess formation, and vegetations of 2 to 4 millimeter can be detected by transthoracic echocardiography. Smaller ones 1 to 1.5 millimeter by transesophageal echocardiography. So you need to know this term. एउटा transthoracic echocardiography भनेको हामीले बाहिरबाट thoraxबाट बाहिरबाट गर्ने transthoracic. So one of them is transthoracic echocardiography, another one is transesophageal भनेको esophagus बाट endoscopic echocardiography पनि हुँदो रहेछ. Sensitivity of transthoracic echocardiography is 65% and transesophageal echocardiography is more than 90%. So you can see the importance of transesophageal echocardiography. Elevation of the ESR, normocytic normochromic anemia and leukocytosis can be seen. So ESR and CRP is more reliable than ESR. Proteinuria may occur and microscopic hematuria 60 to 70% मा hematuria देखेको थियो हैन, is usually present. ECG मा के देखिन्छ? AV block, findings of AV block and occasionally infarction due to emboli. Chest X-ray मा cardiac failure को features हरु देख्न सकिन्छ and cardiomegaly can be seen. Okay, the final part, management. कसरी management गर्ने त अब? Management भनेको microbes लाई हामीले माइक्रोब्स लाई कसरी ट्रिट गर्ने? माइक्रोब्स गयो, ब्लड स्ट्रीम मा छ, ब्लड कल्चर पोजिटिभ छ, इकोकार्डियोग्राफी मा भेजिटेशन्स देखिएको छ, सबै फिचर्सहरु छ, फिभर छ, वेट लस छ, अनड्यू टायर्डनेस छ हैन. कसरी हामीले ट्रिट गर्ने? It's a multidisciplinary approach. Physicians, surgeon, microbiologist, everybody should be involved in the treatment of infective endocarditis. The case fatality is high, 20% case fatality. 10 जना endocarditis लिएर पेशेन्ट एउटा हस्पिटलमा एउटा आईसीयू सेटअपमा अथवा वार्डमा एडमिट हुन्छ भने 10 जनामा 2 जना मोर्टालिटी हुन्छ. So in case of prosthetic valves, and I'm sure it is not less with natural valve. The source of infection should be removed, like tooth with apical abscess should be extracted. That it's a good source for infection of heart. Empirical treatment depends on the suspected organism and whether the patient has prosthetic valve or penicillin allergy. So acute presentation, we can give flucloxacillin and gentamicin. Subacute presentationमा benzyl penicillin and gentamicin. These are preferred. Penicillin allergy, prosthetic valve, or suspected methicillin resistant staph aureus, MRSA, triple therapy with vancomycin, gentamicin, and oral rifampicin can be given. So, acute presentation, it's simple. It's quite simple. Flucloxacillin and gentamicin dinoparyo. Sub-acute presentation छ भने benzyl penicillin and gentamicin दिनुपर्यो. Penicillin allergy, prosthetic valve, or suspected MRSA छ भने triple therapy, vancomycin, gentamicin, and rifampicin. These are the empirical treatment, right? So, how long we give the treatment? For 2 weeks. 2-week treatment regimen may be sufficient for a fully sensitive strains of Streptococcus viridans and Streptococcus bovis. So, empirical treatment of bacterial endocarditis ke ho? Penicillin plus gentamicin when staph infection is suspected, or vancomycin plus gentamicin. And sometimes we can give penicillin allergy ko belama, अथवा suspected MRSA छ भने vancomycin पनि त्यसमा, rifampicin पनि त्यसमा add गर्ने, vancomycin gentamicin को combination मा. Sometimes cardiac surgery is needed in those with staph aureus and fungal infections, and antimicrobial therapy must be started before surgery. So here we can see the treatment regimen. अहिलेसम्म पढेको कुरा. So viridans group of Streptococci अथवा Streptococcus bovis हामीले suspect गरेको छ भने के हुन्छ? If MIC minimum inhibitory concentration भनेको हो है, MRSA हो कि हैन भनेर. यो less than 0.1 छ भने benzyl penicillin र gentamicin नै दिने, 1.2 gram 6 times daily दिने, and gentamicin 1 mg per kg 2 to 3 times daily दिने. If MIC is 0.1 to 0.5 benzyl penicillin and gentamicin, and if MIC is more than 0.5, then the same regimen. Native valve को लागि 4 weeks, or prosthetic valve को लागि 6 weeks लेखेको छ है यसमा viridans group लाई. त्यस्तै गरी enterococcus लाई ampicillin sensitive छ भने ampicillin and gentamicin, ampicillin resistant छ भने vancomycin र gentamicin दिने. यो पनि same duration. Native valve लाई 4 weeks, prosthetic valve लाई 6 weeks. So at least 2 weeks लाई चाहिन्छ भनेको थियो हैन है. Staphylococci penicillin sensitive को लागि penicillin sensitive, penicillin sensitive को लागि benzyl penicillin IV दिने. Penicillin resistant, methicillin sensitive को लागि flucloxacillin, penicillin resistant, methicillin resistant को लागि vancomycin र gentamicin. So you have to remember these things. के penicillin, gentamicin एउटा combination, vancomycin, gentamicin अर्को combination, vancomycin, gentamicin and rifampicin. So ampicillin sensitive to resistant को पनि छ अर्को. Okay, how will we prevent these things? Until recently antibiotic prevention मा अरु केही पनि कुरा छैन. We cannot prevent infective endocarditis without a feature. हामीले थाहा नपाइकन हामी प्रिभेन्ट गर्न सक्दैनौं. तर IV ड्रग अब्युज गर्न भएन. कुनै पनि इन्फेक्सन छ भने, सानो इन्फेक्सन स्पेशली टुथ इन्फेक्सन छ भने त्यसलाई अनसिन गरेर राख्न भएन है. अनि त्यस्तै गरेर अरु इन्फेक्सनबाट बच्नु पर्यो. जस्तो अपर रेस्पिरेटरी ट्र्याक्ट इन्फेक्सनबाट पनि त्यसको कमेन्सल्सहरु जाँदो रहेछ अपर रेस्पिरेटरी ट्र्याक्टको हैन. जथाभावी खायो भने एन्टेरोकोकसले पनि गर्दो रहेछ. फोहोर ठाउँमा फोहोर कुरा खायो भने. So prevention for surgery. Until recently antibiotic prophylaxis was routinely given to people at risk of infective endocarditis for undergoing any interventional procedures. But antibiotic prophylaxis is no longer offered for defined interventional procedures. आजकल सर्जरी भन्दा अगाडि त्यति एन्टिबायोटिक प्रोफाइलाक्सिस दिदैन है. के कन्फ्युजन छ यहाँसम्म? कसैलाई के कन्फ्युजन छ? Okay, thank you.